All right, so for our first video, we're going to go over some of the major study designs and study methods that are applicable in public health with some focus on epidemiology because it's often intertwined a lot with biostatistics. And to get us started off, I want to let you see here in the textbook that we're using, the ebook courtesy of Dr. Winter at Florida. We see that we're going to focus on 1.6 basic study designs. We've got observational and experimental study designs. If you want to learn more about these different study designs or read up more, I'll put a PDF of this free publication. It's from Environmental Health Perspectives. They had a supplemental edition in '93. This is from Dr. Morgenstern and Thomas, both great environmental epidemiologists as well as stats folks in public health. And it gives a little bit of a synopsis, a little bit more text to what I'm going to say in this little short video. So to get us started off, the two major types of study designs that we think about in epidemiology, public health, and biostatistics are observational studies versus experimental studies. Observational studies, what makes something observational? Well, observational means the people doing the study, whether it be you or a hospital or researchers at a university or whomever, the people doing the study do not assign, prescribe, or influence the treatments or exposures. They're not giving out medications. They're not giving people, an education to see whether or not it works to help them reduce tobacco, that kind of stuff. They're not assigning anything. We're just kind of allowing life circumstances to just play out, and then we're going to maybe interview people at certain points in time or monitor certain things that might happen to people just by the way that their kind of life plays out. So these are a lot different than interventional designs or experimental designs, where experimental designs, what people get, whether it be a drug or an education or the opportunity to participate in some fitness program, those are assigned either directly or by chance through some sort of method set up in the study. Those are a lot different than observational studies. But don't be deceived about the term observational, because just because the term observational is used doesn't mean that observations are only used in observational studies. We use observations, we make observations in both types of studies. So we're going to cover in this first video a few of the very easy, simple observational study designs used in descriptive epidemiology, and we'll briefly mention case studies. They're not very helpful for statistical analysis. We'll spend most of the time here on cross-sectional studies, and in the next video we'll get into correlational or ecologic studies. You may remember also from an epidemiology class that there are some more analytical observational studies, such as case control studies and cohort studies, that we'll discuss more in this course. So briefly, just to let you remember, just so while we're on study designs, case reports, case series, these are types of case studies. They're not the best for statistics. They're often more qualitative. The focus of a case report is on a single person. Usually that single person has some sort of unusual or rare disease. Maybe they have Ebola. Maybe they're the first person in Kentucky diagnosed with Zika in a particular year, or a person who had malaria that they contracted within the United States. That would be a big deal if something like that happened. So there would be a little write-up about that person, how they were diagnosed, how old they were, all that kind of stuff. Not very helpful from a statistical standpoint, but does sometimes help alert the public health community. So we use this to describe new diseases and alert public health. Not so much of an effective type of study, again, for statistics. Case series, they're just like the case reports, except for they may relate to several people or many people. a group of whitewater rafting vacationers who come up with some odd, disease from a river, or maybe the first cases of HIV when it was first diagnosed, in the 80s in the U.S. in California. They write up about how old the people were, what they were doing, as part of their life that put them at maybe an increased risk. But it was very much a qualitative or semi-quantitative explanation of what was going on. It wasn't very quantitative. There may be numbers involved, but not for like statistics. Again, these are just to alert people about maybe rare diseases or a cancer cluster. So now, cross-sectional studies, we can do some good stats on cross-sectional studies. So the purpose of this class, again, and why we're covering these study designs, is because before you start doing statistics, as we said the first week in class face-to-face, we have to think through what we're doing, why are we organizing the study a certain way, what's our reason for doing it, how many people should be participating, and have some sort of plan in place for how we're going to actually analyze the data when we actually collect the data. So cross-sectional studies, they're studies where maybe we do a survey, or we call people through and do a survey that way, or we do a web-based survey where we send out, a link for people to participate. These are studies that are conducted over a very short period of time. Well, it doesn't have to be, but a short period of time. But for the individual will only participate one time. There'll be no follow-up period. We're not going to follow these people and call them back a year later and keep track of that. That's a cohort study. We'll talk about that later. But like the cohort study that we'll talk about later, the unit of analysis is the individual. We gather data from single people, from a single person, and we may gather data from 100 single people, or 1,000, people, or 2,000 people, or 10,000 people. Regardless, the unit of analysis is the person level, and we will organize the data. We will organize their exposures and their health history and their demographics and all of that around the individual in our data sheet, and then when we do our data entry into a spreadsheet of some type. So the goal of these studies, and these are just snapshot studies, they just gather their current situation, their current thoughts, current history, but we have nothing other than that. The goal of these is to maybe get the current disease status of the population. Have you ever had cancer, or maybe a certain exposure? Do you currently smoke? How many fruits and vegetables do you eat per day? What's your income? How many children do you have? All those types of things, we'll get that one answer for each individual. We may be able to identify the exposures that may be related to a person's health condition, or we may be able to identify some determinants, like maybe their income, that may be related to the health of a given population. So all these things can be helpful. And then we can take all of the data for a particular cross-sectional study and maybe even estimate what the prevalence is for that population. So what's the prevalence of smoking among students attending a particular university? Or what's the prevalence of e-cigarette use among high school teenagers? But before we can estimate prevalence for a population, we need to know who is in our universe. Who are we studying? Are we studying all the high school kids in Kentucky? Are we studying all the bus drivers, in Ohio? Who are we studying? Who's our reference population? This is the people that we care about on a particular topic. Now, we know that we may not be able to sample everybody in our universe or get data from everyone in our universe that we want to generalize our information to. So we can develop a good sampling plan to get people to participate who then would be a representative sample of what's going on in the general population. So they say in the U.S. that during the census, which is required due to our founding documents may be a little overkill, and that we could get more bang for our buck by doing something like what the census does during the off years and do a really thorough American community survey and get a lot more information from fewer people. But needless to say, if you've got a good sample, you can really make some strong inferences about what's going on in the reference population. So you don't have to survey every person to get, what the true average is or the true population prevalence is for that population, or at least to get a really good estimate that will at least tell you that. Nationally, the Department for Health and Human Services, I believe through the CDC, they work with the state governments to do the behavior risk factor surveillance survey, so we can get information on alcohol use and I think even now texting and driving, but and smoking for adults in the United States. They also do this in certain schools throughout the United States, working with the state health departments to do the youth risk behavior survey to kind of get ideas on the mental health of the children, as well as maybe their drug use, whether or not they're using e-cigarettes, all that kind of stuff. Those are all examples of cross-sectional studies. We're not following people through time, we just get the data today. The data for these cross-sectional studies, when they're collected in a survey form, they can be entered in a way where all the information is on a single individual, and it's entered this way, and that's helpful for when we do our statistical analysis later. So you can see here that this is survey 1504. This was a single person. Have they ever used e-cigarettes? And 1 equals yes. Have they ever used e-cigarettes in the last 30 days? That's yes. They were coded as a regular e-cigarette user. Are they a freshman, sophomore, junior? You see junior. Where do they live at? Off campus. Maybe some questions about their in Greek life, like a fraternity or a sorority. Do their parents smoke? All that stuff is gathered at the individual level. And it's important to keep it at the individual level, because then we can aggregate it later if we want to. But we can do a lot more powerful statistical analysis by keeping it at the individual level. A lot of folks don't realize that until you start practicing biostatistics, how important it is to keep this individual level data together as long as possible. So some advantages of these cross-sectional studies is we get the data from individual study participants. The data from their confounding variables can be collected: age, gender, smoking, alcohol consumption, how much money they make, whether they had college education or not, what meds they're on. All that can be collected and then organized at the individual level. So that's really important to be able to do that. These types of studies are short term. We don't do follow-up, so that makes them cheaper and they can be done more quickly than a cohort study where we might follow people. If we do a good job sampling, our results can be generalizable to the reference population, the big population, and we may be able to even estimate the risk of a particular disease or outcome. Like if we asked about asthma, we may be able to estimate the prevalence odds ratio for asthma for a given subset of our population. It is hard though with these to tell which happened first, the exposure or the outcome. So in the case of like the youth risk behavior survey, kids that drink alcohol at 14 are more likely to have had suicidal thoughts than kids who are 15 with their first drink of alcohol. So with that said, we don't know which happened first, the suicidal thoughts or the alcohol exposure. It would take a different type of survey approach to do that. So some disadvantages: it's hard sometimes to know which happened first, the exposure of interest or the confounder of interest or the potential or disease of interest. And some things are just too rare to detect. You can't survey people for pancreatic cancer to see if they ever had it or not. You're going to have to survey like 1 million people. It's not practical to do this type of approach. And then who participates? That's also a big bias. So people are more educated, well off, or care a lot about your topic may be more likely to participate or not, but all surveys have that problem. So the next one we're going to cover here in the next 15 minutes are the correlational and ecologic designs. So that's coming up next, so tune in to that particular video next.